name is Rupen Odabashian. I'm a hematology-oncology physician. I'm very interested in AI. And I'm creating this course for other physicians who are struggling with AI or they are new to this world. And this course to be a foundation for them to start using more large language models and AI and not to feel overwhelmed with this all fast technology changes that's happening on daily basis, which can even sometimes make me feel overwhelmed. So this course is there to help you, to show you what are the drawbacks and the benefits of using AI and how to evaluate any AI tool that you use in your clinic as a physician and with your patients. You have to understand that these AI tools, they have their own positives and negatives, just like any tool, and they have their own use cases. I always give an example, like if you are doing a CBC, complete blood count on your patient on daily basis in the hospital, and their hemoglobin, for example, has been always around 14 every single day, and then one day it's 7. You repeat the CBC because you ask yourself, this might be an outlier, this might be a mistake. It doesn't make sense. The hemoglobin drops 7 points in one day. So you are able to detect that mistake, but but the CBC again is not replacing you. That test is not replacing you. It's giving you an info that you can't really do on your own, taking the patient's blood and measuring the number of red blood cells and hemoglobin. Your role is to think about the hemoglobin and how that impacts your care on the patient. The same applies for AI. It's a tool to help you on how to approach your patient, how you treat your patient, and it's going to be used to augment your skills. In this lecture, there are several subtopics that I want to cover, but I think we can skip the history. I want to talk about the foundation models and the large language models and the prompt engineering for physicians, how we can use LLMs in research, how we can use LLMs in the clinic, how we can use LLMs while learning and teaching, and the challenges of using AI and LLMs, and how you can stay updated. So mainly I'm touch basing on, I'm covering every aspect of physician's life. As physicians, we do research, so I'm going to talk about how we can incorporate AI into our research. As physicians, we are in the clinic seeing patients, so I'm going to talk about how we incorporate AI in our clinic. I'm going to talk about how we incorporate AI in learning. We are all lifelong learners. And in teaching as well, how we can teach medical students, residents, and fellows using AI and augment their abilities and improve our skills as teachers. I'm going to touch base on the challenges. There are still challenges that at this day might be different from in 2 years, that the challenges that comes with AI. But I think one of the challenges that always going to stay there is privacy. I don't think this challenge is going to change, and we have to always think about how we approach this and how we can stay updated in this day and age. Okay, without further ado, let's jump in and let's start our course.